Welcome to our video series called Industry Viewpoints, brought to you by the American Bankruptcy Institute. Each segment will feature an expert providing views on the current state of a particular industry with a focus on what lies ahead. My guest on this edition is January Bailey, a partner at the firm Prelle Eron Bailey in Wichita, Kansas. January got more degrees than you can shake a stick at. She got both a BA and a BS from the University of Kansas, and as if that wasn't enough, she topped off her education with both a law degree and an MBA from the University of Cincinnati. Here at ABI's annual spring meeting in Washington, D.C., January was the moderator on a panel called Failing Healthcare Systems with Patients Driven into Bankruptcy by Medical Debt. In a country like ours, which does not have universal medical care, getting sick and having no healthcare insurance can be devastating. Empirical studies have shown that medical debt is a leading cause of personal bankruptcies, and on the other side of the coin, hospitals are required to provide care regardless of whether someone can pay. That means the demise of hundreds of smaller hospitals in this country, often in rural areas that are poorly served in the first place. And that is exactly what we're going to be talking about with January in the next few minutes. So, I shot my mouth off there, but let's get down into the weeds with somebody who actually lives the life that I've just been talking about. And my first question to you is this, January. When new clients come into your office to file personal bankruptcies, chapters 7 or 13, is it often, seldom, or never the case that they have medical debt?
Thanks, Bill. It's a good question. Most of the people that come into my office with debt have medical debt in one form or another.
Most?
Most.
Really?
Very few of them have, I would say, less than $1,000 worth of medical debt. A lot of them have a lot more. I have a lot of clients that come into my office with stacks of bills, and usually most of those are medical bills or the collection agencies for those medical bills, or at some point a lawsuit on those bills.
Are these people that have medical debt have no insurance?
No, most of them have had insurance. A lot of times this is the deductible because they have a high deductible plan. Or they just have really bad insurance. Some of them, it is from periods where they went without health insurance. A lot of people lost their job in 2020 and went without health insurance for a while. So we're starting to see people come in now who have medical bills from 2020 that they're just now starting to take action on as far as lawsuits and stuff that's prompting those clients to maybe come in.
Oh, wow. So the pandemic has a delayed effect in an area like this.
Well, yeah, definitely, because at least in Kansas, there was a long period of time where you couldn't sue them.
Yeah.
And I know across the country it was that way. So the fact that the creditors couldn't sue the debtors led to a backlog, and so some of them are just now getting around to doing that.
Well, I guess maybe that's one of the reasons we're seeing a substantial uptick in consumer bankruptcies, especially Chapter 13. Well, that makes sense. Listen, along the same lines, let's assume that a client comes into your office contemplating filing in Chapters 7 or 13, and that person does not have medical insurance. Do you give them any advice about insurance?
Absolutely.
What's that?
Well, people that come into my office without health insurance, they're usually in one of a few different situations. Maybe they don't have health insurance because they're currently unemployed. If they're currently unemployed, it's probably not their best option to file right now anyway, unless there's something else that they need to file because of.
Oh, so in other words, you won't take the fee and file them when it's not time yet. Is that right?
If they want to, they can, but
Yeah.
I advise them, hey, this may not be the best timing for you, just because you want to file when you're past your lowest point. You don't want to file when you're on your way to the lowest point. And if you're unemployed, you don't know yet if that's your lowest point.
Oh.
Some people come into my office and maybe they've just started a job but don't quite have the health insurance yet. And if that's the case, I usually say, hey, you came in almost with the right timing, but the right timing may be in 2 or 3 months once you get the health insurance.
Why is that?
Well, because if they file a bankruptcy today and they don't have health insurance, and next week they fall and break their arm, they're going to be stuck with these medical bills.
And not discharged.
Exactly.
Oh, I see. It never dawned on me that part of advice on when and whether to file bankruptcy deals with your medical insurance situation.
In my mind, it's one of the things to keep an eye on. Most of the people that come into my office are employed, and when you're looking at their pay stubs, they have health insurance as a deduction, and so no problem, nothing to even just check it off the list of things to think about.
Yeah, right. Well, you live in an area that's certainly not a giant metropolitan area. How many folks in Wichita?
So
Population-wise?
Wichita is about 500,000 people.
Okay, it's not small.
And Kansas itself is between 2 and 2.5 million people. So although we are the 14th largest state in size geographically, we are one of the smallest in terms of population.
Yeah.
And that has, a lot of my clients come from my metropolitan area of Wichita, but a lot of my clients come from very rural areas.
Well, that's what you're really saying, is that Kansas is a rural area. That's for darn sure. Probably a long way from a lot of people's homes to a hospital. But with regard to the state of hospitals in rural states like Kansas, are these big hospitals, little hospitals, or what's the makeup of these places?
So nationwide, about a third of our hospitals are rural hospitals. And of the yeah. Well, because you could have 2 or 3 small rural hospital for every one big one that you have.
Yeah.
But these rural hospitals, half of them have 25 or fewer beds.
What? 25?
So when you don't have a lot of population, you don't have a lot of need for hospital beds.
Well, I would venture to say it must be very difficult for a hospital to turn a profit with 25 beds.
Absolutely.
Because occupancy can't be 25. It's got to be some small fraction of that.
Well, and most of the time these facilities are either taking care of minor wounds or they're just treating someone until they can be transported to a bigger hospital.
That's not good work.
Well, it's not going to get them a lot of funding.
Exactly right.
One of the interesting things that I came across as I was doing research for this panel is the part of the CARES Act that was passed in December of 2020 created what's called a rural emergency hospital, basically allowing for more funding for these rural hospitals, including monthly Medicaid payments. A lot of rural hospitals have been in great financial distress over the last several years. Now, you got a lot of funding with COVID, and we had fewer closures, but particularly these rural hospitals just weren't getting enough funding pre-COVID to survive.
And so what's this? What was this called? What was this act called?
This part of the CARES Act, it's creating what's called a rural emergency hospital. Basically, it is allowing for these monthly Medicaid payments. These facilities, they have to have an agreement with a level 1 or level 2 trauma center so that they can transport the patients. They can have outpatient services at these facilities. And they don't have to have overnight stays. They don't have to have the ability for these people to have overnight stays.
So you can maybe do it with one shift, and you don't have to have.
I think that at least the one that I looked at, still had a 24-hour, probably more like a 24-hour on call.
Yeah.
But and so it was technically open 24 hours, but. Yeah, I mean, basically like doctor's office that's open 24 hours.
Yeah.
I'm not exactly sure.
That's creative.
Yeah, and so they just started these in January of 2023 is when this rule went into
that's
effect.
Very new. Then.
Yeah.
Has there been anything else on the legislative front that has helped to address problems of either hospitals or consumers when it comes to medical debt?
Yeah, so one of the things that I'm not sure that we've seen any impact on yet, but I'm sure we will in the next few years, is the No Surprises Act that was passed and went into effect about a year ago, last January. The No Surprises Act does not allow a patient to be billed for out-of-network services for something that basically should be in network. So if you go have a surgery, normally you'll get a bill from your doctor and the anesthesiologist and the facility itself.
The pathologist, yeah.
All of these places. Yeah. And so sometimes what happens is you get an out-of-network bill because the anesthesiologist isn't in your network.
Oh.
And that is not going to be allowed anymore. There's also some rules with this No Surprises Act about people without health insurance being able to get a good faith estimate of what their services will cost.
Yeah. I've often wondered why somebody couldn't go to a hospital and negotiate the price. Say, I'll pay you cash, I'll give you a check in advance, but I want it to be at the insurance rate.
And
I wonder why people can't do that.
Some of them try to do that afterwards, but
it's you don't
the
have
hospitals.
The leverage.
Yeah, exactly. They don't have the leverage. That's why there are some health insurance companies now that basically they're self-funded health insurance that negotiates that price for the consumer, and they share in the cost.
Oh boy. Well, all of this tells me we have a way to go before we can perfect our healthcare system.
Hey, it's good for business though, right?
Well, apparently I was going to say the only good thing about it is it keeps some bankruptcy lawyers busier and probably collection agencies for
Absolutely.
The hospitals. Well, January, I thank you. This has been a very enlightening discussion. And we have a healthcare problem in this country, both for people who get sick and for the institutions that provide care. And we certainly thank you for your insights. And we thank you in the audience for tuning in the Industry Viewpoints series in upcoming days and weeks. We will talk with other experts about the future of industries that are affected by our turbulent economic times. Until then, be well, stay safe, and good day.